Remillard? Alright, well, my name is cambriaremillard2, and today I'm going to talk to you about the Garrison diet. But first I want you to think about what you ate today. Did you grab some fast food on your lunch break, or perhaps grab some chips and candy throughout the day to munch on? We all know these foods aren't good for us, but they taste so good, and they're hard to live up in a busy lifestyle. A few years ago, I was personally challenged with changing my eating habits when my mother's doctors found tumors on her liver. That's why I want to talk to you about the Garrison diet. It changed her life and my entire family's. Today I'll explain who the Garrison diet is geared towards and why, what the diet is, and how at a moderate level it can increase your overall well-being. To understand this therapy, we need to first take a closer look at who chooses this sort of diet and why. Originally it was developed as an alternative cancer therapy. There is no guaranteed cure for cancer, but the most common form of treatment is chemotherapy, which can be very stressful and invasive for both the patients and their families. That's why so many people choose an alternative or a natural approach to fight their battle against cancer and maintain a better quality of life. Chemotherapy started being used for cancer in the 1940s and has been developing ever since. COMM describes it as a drug that kills cancer cells directly using a variety of chemical treatments. Doctors will use chemotherapy because they can control tumor growth when there's no cure. They can shrink tumors before surgery, it relieves cancer symptoms, and it can destroy microscopic cancer cells that may be present after a known tumor is removed. And while cancer works great for some patients in their cases, other people can't handle the effects, the strong side effects tied in with cancer, like my mom. Chemotherapy's most direct mission is to attack cancer cells. However, it also attacks healthy cancer cells as they're dividing. This is a picture from an article done on mesothelioma chemotherapy. It shows the most common side effects of any type of cancer treatment. When cells that divide rapidly and frequently to replenish themselves are more likely to be attacked by the chemicals in chemotherapy, such as your intestines, your bone marrow, your skin, and your hair. Macklin Cancer Support goes over how chemotherapy directly affects the cells in our bodies. So let's look at our bone marrow. Your bone marrow produces 3 types of cells: your red blood cells, your white blood cells, and your platelets. Your white blood cells help your body fight against infections and bacteria. They're also called neutrophils. According to medicine.net, when a person's body is unable to fight off bacteria and starts becoming infected, it's called neutropenia. That's why people who are going through chemotherapy are much more susceptible to getting infections from everyday common colds or even the flu. Then you have your red blood cells, which transport oxygen around your body. When your red blood count is low, you become anemic. You're feeling very lethargic and sore, you're shortness of breath, you're tired. Last is your platelets. When your platelets are low count, your platelets help your blood clot. So when you don't have many platelets in your blood, your body will bruise very easily or perhaps bleed heavily over minor cuts and scratches. So even though chemotherapy has proven results to reduce cancerous tumors, people don't always want to go through that stress. That's why people choose a natural approach such as the Garrison diet my family chose. It's important to remember that the Garrison diet isn't for every sort of cancer. Sorry. However, people would say that half the battle is a positive attitude. So the Garrison diet, and that's exactly what the Garrison diet does, because it gives a patient control over their disease and over their battle. It boosts their mood and their confidence while eliminating the side effects of chemotherapy. So now we have a better understanding of why a cancer patient would choose the alternative over chemotherapy. Let's look at what chemotherapy is. According to the Garrison Institute, based in San Diego, California, the therapy activates the body's extraordinary ability to heal itself through organic vegetarian diet, raw juices, caffeine enemas, and natural supplements, treating the underlying causes of disease, toxicity, and nutritional deficiency. Max Garrison, a German physician, developed the Garrison diet in the 1920s. According to the International Journal of Cancer, Garrison felt that in order for the body to heal itself, it needed to be detoxified from agents that rendered it hypersensitive to abnormalities such as the cancer cells. The Garrett Institution breaks it down as simply as an entirely organic organic vegetarian diet that is naturally high in vitamins, minerals, enzymes, and extraordinarily low in sodium, fats, and proteins. The first thing that the Garrison diet requires you to do is drink 13 glasses of organic fruits and vegetables freshly prepared an hour. These juices include 1 glass of orange juice, 4 glasses of leafy greens, 4 glasses of pure carrot juice, 1 glass of apple juice, and 3 glasses of apple and carrot juice. On top of these, patients are expected to eat three completely vegan meals a day. So this could be like a salad, cooked vegetables, or a soup. Then after that, they're given a strict dietary supplements from B12, thyroid hormones, and potassium. And finally, they're given coffee enemas to flush out their liver. So you're probably sitting there, that's great, but I don't have cancer and I don't know anyone who does, and I get it, because the Garrison diet isn't the normal lose weight quick program. It's so much more, because everything it requires us to put into our bodies is beneficial to everyone's overall health. The diet is geared towards getting rid of cancer cells. So the only thing it can do to our bodies is increase our chances of fighting off diseases in the future. Things we're putting into our bodies nowadays, like soda and Taco Bell, are breaking down our organs every day. So even just making ourselves a glass of fresh orange juice or carrot juice with a daily meal will improve your mood and energy by providing your body with the vitamins, nutrients, and minerals you need on a daily basis. Just think of it as like a V8 on steroids. It isn't hard to start. So by now you should be aware why cancer patients would choose the Garrison diet over chemo, why people choose the diet over chemotherapy, what the diet is, and another alternative eating habit for yourself.